Welcome to this educational program we're providing on NLP Logics, and today we'll be talking with Healogics and looking at the unique uses of AI and machine learning as tools you can use in your business. So today I've got two great people joining me, Katie Bakewell from NLP Logics and Mary Sheridan from Healogics, and they're going to be the two talking about the products that they've come up with and how they're using it at Healogics. So why don't we start first, Katie? Could you introduce yourself, a little bit of your background, and what NLP Logics does?
Sure. I'm Katie Bakewell. I am the lead statistician at NLP Logics. I've got a bachelor's in math and stats and a master's in math. I've been with NLP Logics for 6.5 years, and we are a machine learning AI automation shop here in Jacksonville, Florida. We sort of specialize in taking machine learning and robotic process automation, different automation technologies, and making them applicable and productionalizable in business.
And how about you, Mary?
Hi, I'm Mary Sheridan. I'm Senior Manager of Advanced Analytics at Healogics. I manage all our research and analytics projects under our strategy team, and I've been with Healogics for about 2.5 years. My background is I have a PhD in clinical psychology with a health emphasis. And I started more in academic research and have migrated to more corporate research and analytics. And prior to Healogics, spent about 10 years really working with different companies to help them utilize their data, create actionable insights, and help them drive their corporate and business decisions. Healogics is the largest provider of advanced wound care in the United States, and we're based here in Jacksonville. We have over 600 outpatient wound care centers, and because of this large network, we have the largest database of wound care specific health data available to us. And this allows us to really be at the forefront of evidence-based wound care and really be able to continually improve the clinical practice and guidelines of wound care and create the best healing outcomes for our patients.
And you recently had a press release announcing some of the analytics work you were doing and identifying patients and some of the stuff with NLP Logic. Could you talk about that and what it was you were trying to solve?
Sure. So people who are not familiar with wound care may not realize that patients with wounds are some of the most health compromised individuals. They often have multiple and complex comorbidities, which really can either initially cause their wound or make it very difficult for them to heal their wound. So when the COVID-19 pandemic came about, obviously we were very concerned of our patients because of their medical conditions. They are some of the most vulnerable to this infection. And so we really needed a way to protect our patients, but also ensure that those who really do need to be in the center for treatment are able to get that. So we needed a way, a tool to really provide our center staff and providers a way to identify those patients. How do we take all the active patients we have and really determine these patients really need to be here, because if not, their wound condition is going to really be compromised and they may end up as an inpatient in the hospital for a larger infection or more complicated health condition. So it was imperative for us to roll something out very quickly, provide a data-driven tool to our providers to be able to assist them during this really unprecedented time.
So you were in essence trying to develop a tool to identify the most high-risk patients or potentially at risk so you could make sure that you followed through with them based on this large data set that you had. And Katie, can you talk about what you built and how it was able to do that?
Sure. So this project started a few years ago. NLP Logics and Healogics partnered together to build a comprehensive wound healing model. And that model was built to answer two questions. So the first question is what typically gets asked about wound care. Is this wound going to heal? So we built the probability that the wound would heal. But then there's a second problem that's a little bit more complicated. There's a huge loss to follow-up for patients in wound care. Like Mary said, there's a lot of comorbidities at play. So there's a lot of hospitalization, and then there's also patients who quit. So we built this model to help identify both of those pieces. Will the wound heal, and will the patient successfully complete treatment? So when the COVID-19 panic started, or when the COVID-19 pandemic started, NLP Logics worked with Mary and her team to identify, we had this model that was built for patients at the beginning of their treatment. We worked with the team to identify, is this model going to be able to extend and look at patients that are already in treatment and protect that group? So those new results showed positive signal, and it confirmed that the model was going to be production ready for this second use case where we have people who are already in treatment.
And how, Mary, have you been using this, and what have been some of the results?
Sure. So we implemented it into basically a dashboard report so that providers can take the score, and we convert it to more of a high, medium, low risk rating to make it easier. Could take that information, look at all their active patients and sort them, and also look at all their other additional data about how long they've been in treatment and their wound condition, other wounds. So they can take all that data together to really assess and kind of prioritize which patients they really need to kind of really follow up with and be aggressive with during this time. And we've gotten really good feedback. A lot of center staff and providers are very happy to have another piece of data that, again, can help them make those decisions and assist them in that decision-making process.
And obviously, this has been a difficult time with the pandemic going on and access to healthcare or lack of access to certain services. So has this allowed you to then reach out to some of these individuals that were potentially going to flare up or have a problem and then head that off?
Exactly. So it kind of worked in two ways. So we did implement some telehealth solutions. So there are some patients that if they're at low risk, we can probably use a telehealth solution to just monitor, make sure that everything's okay, nothing's changed significantly in their wound, everything looks good. But then it also helped to say, hey, these are the patients we really, if they cancel, we need to call them, we need to make sure and explain to them why a cancellation could be really detrimental to their health, and that in-center treatment is really what they, really important and isn't something they should skip out on just because of fears of, getting additional infections while at the center, being at risk for COVID. So I think, it really helped us scale on both ends to prioritize those patients.
Fantastic. That's really great news. And I know everyone's looking for new and unique ways to solve the healthcare problems we're facing today. And obviously mixing that data analytics with things like telehealth allows Healogics to broaden their reach and get to individuals that maybe you can't. For the final question, Katie, could you perhaps just touch on some of the other areas of applicability to some of the services that NLP Logics has?
Yeah, so I think the main thing here is it's response modeling. So it's looking at a patient and, what's their likely response. So we use the same thing. It sounds crazy, but, when we look at debt collection models, it's the same. Will the patient respond positively? So when we talk about these models and the machine learning behind them, anywhere where we have a yes or no question, this same sort of technique can be really applicable. One of the biggest barriers that we see is adoption. So people will go and they'll build a machine learning model, but then, nobody wants to adopt it. And I think Healogics has done a really great job of being an example of how you take, a model like this and actually implement it and bring it into the system. So rather than, just building a model and having a new set of results that nobody's going to look at, Mary and her team have done a really good job of, getting over that barrier and being able to implement.
Great. Well, thank you, Katie, so much for joining us. And thank you, Mary. It's a pleasure to have you both. And if you want any more information on NLP Logics, you can go to nlplogics.com, or on Healogics, go to healogics.com. And note, please, that NLP Logics is spelled with an X on the end of Logics.